Hi, my name is Jennifer Burgos, and today we're going to be talking about the effects of diabetes on the body. So, diabetes is a disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. An increase in type 2 diabetes is really prominent in the United States right now. We attribute that to an increase in processed foods, an increase in meal portion size, and a decrease in exercise. Children are especially at risk right now for getting childhood diabetes, and we are attributing that to an increase in technology and a decrease in the children going outside and playing, and they're drinking a lot of sugary substances. And so right now our youth is really at a risk for getting type 2 diabetes. So it is the most common form of diabetes in the United States, and it causes multi-organ impairments. So diabetes can be diagnosed pretty simply. There's several blood tests that can be done, a fasting blood glucose level or a random blood glucose level. Usually anything over 100 is abnormal and is either pre-diabetes or diabetes. There's a 3-month percentage test that can also be done, and it's called a hemoglobin A1C. And that gives the providers a value, a percentage value of what the glucose levels are within a 3-month range. And anything usually above a 6% is diabetic. Random blood sugars, again, that is can be done in the office, where you prick your finger. You don't have to be fasting for that. But again, anything above 100 is usually pre-diabetic or diabetic. 3-hour glucose testing is also done. Usually that's typically done with gestational diabetes, where they give you some form of liquid sugary drink. It's like kind of gross, tastes like orange, really sweet orange soda. And they take your blood sugar before you drink it, and they take it after you drink it, and then 1 hour, and then 2 hours, and then 3 hours after you drink it. And then also urine analysis can be done, because there should be no sugar in the urine. And it's said that, before there was any testing, stuff done, back in the day, they would taste the urine, and if it was sweet, then they would know there was sugar in the urine, which is gross, but I guess they did what they had to do. The 3 P's of diabetes: polyuria, which is the need to urinate frequently; polydipsia, which is increased thirst and fluid intake; and polyphagia, which is increase in appetite. Those 3 things are usually very common in the new onset diabetes or uncontrolled diabetes. Diabetes can cause a multi-organ effects. So kidneys are usually usually they are damaged, or some kind of damage, or they're at risk of being damaged with diabetes, especially uncontrolled diabetes. So the key thing is uncontrolled diabetes. And that can cause renal failure, and which can lead to dialysis. Kidneys, if there's any damage or any effect to the kidneys, which also can cause hypertension. So a lot of the patients that have diabetes are usually hypertensive. They are also more at risk for cardiac issues, and they are more at risk to have CAD, which is coronary artery disease, or stroke syndrome. So we always want to monitor patients that are diabetic, and making sure that their heart and their blood pressure and everything is always in range. Damage of the walls of the capillaries, especially in the legs and feet, is very common. This can cause tingling, burning sensation, numbness, which is also known as diabetic neuropathy. Poor circulation in the lower extremities is also very common in diabetics, and this is very dangerous and very scary for physicians and for the patient, because diabetics are usually prone to getting infections in their feet, cuts, sores, ulcers, whatever. And because of the poor circulation, because of the numbness and the neuropathy, they usually do not know that they have this. And when they don't know that they have these kind of issues, it can cause severe infections. And because diabetics have poor circulation, they have a longer healing process. And if this goes untreated or unnoticed, it could lead up to amputation, gangrene. Many things can happen because the circulation is so poor, they just don't know that they have these issues, or it is so hard to treat and heal. Diabetics must also take care of their eyes. They are more prone to getting diabetic retinopathy that could lead to blindness, glaucoma. So they need to make sure that they're going to their annual eye exams and making sure that they do not have any of those issues. All of these issues are treated manageable if caught, on time. Yeast infections are very common in women, sometimes in men, but most common in women that are diabetic. And dry skin is also common in both male and females. Oftentimes, to manage diabetes, the physicians will give the patients the option to manage it with diet and exercise if the glucose levels are not so elevated. And then they'll have them come back in 3 months and recheck it and see how that diet is working. However, if they are not able to manage it, if they're just having effects of it, they're not able to manage their diabetes through diet and exercise, an oral medication is usually introduced. If the glucose levels are extremely high, then insulin is introduced. There's several different oral medications. There's several different insulins available. People usually think diabetes goes hand in hand with insulin, but it does not always have to be like that. And it's really nice also that if they are diabetic, if they do have to take insulin, there's so many new insulin pens. So it's not always just the vial and the syringe anymore. There's little insulin pens that are portable. They could take it with it. It does not have to be refrigerated. And so, there's options for them. So either it's an oral medication or an insulin. Just know that the medications that are oral are going to be tablets or capsules. Insulin is not an oral medication. So living life with diabetes, you can have a great, normal, healthy life. The patient just has to be willing to put in that extra work. Their food has to be monitored. They can't go crazy with, sugary foods. Even the fruits and vegetables, some of them are high in their glycemic levels are high, so they need to monitor which foods they're eating. They need to incorporate they need to incorporate exercise into their lifestyle, just adjusting their lifestyle completely. But it's manageable and it's doable. Just taking your medication, making sure that you're taking your medication on time, the way that you're supposed to be taking it. There's so many resources out there for new onset diabetics. The insurance companies usually offer nurses, 24-hour nurses. The drug companies have nurses. They have education hotlines. The hospital usually have diabetic classes. Even like Publix now has a nutritionist where you can go and talk to her or him. They'll walk you around the store, show you what foods are good to eat. So there's so many things out there right now for diabetic because of the increase in diabetes right now that is so crazy. So there's so many things to help people out that are diabetic to help them manage their diabetes. Just knowing that it's not a death sentence. However, taking it very seriously because diabetes unfortunately does not show so many effects on the outward body as what it's doing to you on the inside. And so people think, oh, nothing's the matter until sometimes maybe it's too late, until they do have kidney disease or they do have hypertension or cardiac issues. They do start to get neuropathy because they're not really managing, they're not taking it seriously, and that's what happens. So you just want to make sure that we take our diagnosis seriously and do everything that we can to be proactive and making sure that we don't get any of these other issues that are associated with diabetes when it's not properly managed. But so I hope that you got some information and some tips from my little presentation and learned a little bit more about type 2 diabetes. Thanks.